Welcome to our Prenatal Wellness Talks. Today, it is a true honor to be in conversation with Dr. Sarah Buckley, a physician, researcher, and internationally respected voice in the field of physiological pregnancy and birth. Dr. Buckley is widely known for her work on the hormonal physiology of childbearing, helping to bring a deeper understanding of how processes such as oxytocin shape not only labor and birth, but also the early relationship between mother and baby and the foundations of lifelong health and well being. Dr. Buckley, it is such a pleasure to have you with us. Thank you for accepting our invitation.
My pleasure, Susanna.
To begin with, could you tell us a little bit about the work you are currently most devoted to, particularly your research into the hormonal physiology of pregnancy and birth?
Yeah, thank you. So I've studied a lot of the hormones of pregnancy, birth, and early parenting. I wrote a report called Hormonal Physiology of Childbearing in 2015 with an American group called Childbirth Connection, which was a great opportunity to really delve into those hormones. And what I've done since then, since the publication of that in 2016, I started doing a PhD here at the University of Queensland in Brisbane, Australia. And I was very privileged to work with some of the world experts in the area of oxytocin. So that's what my research has been dedicated to in these last 10 years. And what we've been doing, and we'll be talking about this in some detail, no doubt, but what we've been doing is what's called systematic reviews. And this is a research methodology where you gather together, use a particular way to access the databases that have all the research in them. And it's like throwing a net over there and you bring in the ones that you want. And what we've done is looking at the studies that have measured plasma levels in the blood of oxytocin in women and or their newborn babies in relation to physiological birth. That was our first publication, working with these European researchers and my colleague, Professor Kirsten Uvnas-Moberg. And then we looked at oxytocin levels in breastfeeding. And then I published a paper on oxytocin levels with synthetic oxytocin, Pitocin. And I've just in the process of publishing or getting published a systematic review on oxytocin levels with epidurals. And we also have one waiting in the wings, which is oxytocin levels with cesareans. So what's great about these systematic reviews is they're very well in kind of the hierarchy of medical evidence. The systematic review is the most authoritative. So we haven't just done one study, we've actually gathered together all of these studies. So we can make some fairly rigorous pronouncements about it in terms of what these interventions, what physiological birth does to oxytocin, and then what these interventions do as well. So I've actually submitted my PhD last year and waiting for that to be examined. But in the meantime, I'm working on getting these papers published.
Oh, that's so wonderful. We would like to hear more about it because it is interesting the work that you are doing. And by the way, congratulations on your PhD. I know that that's a lot of work. But what do you want most people to understand about the hormonal blueprint of labor and why it matters for both mother and baby?
Yes, what I want people to understand is that labor and birth are designed to work. And by work, I mean they're designed to optimize reproductive success. And that's whether you're a human or an elephant or a cat or a dog. We're all mammals and we all share a very similar, very common hormonal physiology. And it's designed to work so that labor and birth are successful because, they're rigorous, challenging experiences for both the mother and the baby. And again, we're talking all mammals here. But it's also critical that lactation, that breastfeeding, is successful because if that doesn't happen, the babies won't naturally survive in the wild. So you could say there's a lot of, I would describe it as evolutionary investment in reproductive success, in successful pregnancy, labor and birth, and then the early parenting or early mothering stuff, which is breastfeeding, as I said, or lactation in mammals, but also mother-baby bonding, because, any other mammal, dogs, cats, elephants, they don't go to classes to learn how to take care of their babies. It has to happen through these processes of labor and birth, and we'll talk about that some more. But it is critical because, you could have a successful labor and birth, lactation could be successful, but if the mother isn't, as I say, rewarded and motivated to take care of her babies, they're not going to survive. So all of these things are hardwired into the hormonal physiology of labor and birth for all mammals. And as I said, my most recent studies have been in oxytocin. So the oxytocin system is common to all of those things. It's active during pregnancy. It's very active during labor and birth. Oxyfast tocin birth, that's what the hormone was named after. But it's also the critical hormone of breastfeeding. It's the hormone of the letdown or milk ejection reflex that makes the milk available to the suckling baby. And it's also an essential hormone for maternal infant bonding in all mammals. So it really is well, it is, as it's colloquially known, the hormone of love, because it's so involved in all these facets of reproduction.
Yeah, and what do you think are the greatest misunderstandings or the blind spots that we see on our mainstream maternity care, and how does that impact the oxytocin system that you have been studying?
Well, I think to start with, just not trusting the physiology, not really understanding how embedded, how hardwired it is into our systems as humans, as mammals. We're hardwired that oxytocin will help us to succeed in all of these things, and in pregnancy, labor and birth, breastfeeding, and attachment. So not understanding physiology, and sometimes modern medicine, or obstetrics anyway, has a bit of an engineering approach. We think we just get the numbers right, then the whole thing will fall into place. But oxytocin is a relational hormone. I'll talk a bit more about oxytocin in a minute, but it's a relational hormone, and labor and birth are relational events. And it's very interesting, because what we see is that those if circumstances or environments that have that relationship built in, like a doula, a supportive birth companion, like having your own midwife, like traditional models of care, where the midwife, like my great-grandmother, was someone in the community that knew all the birthing mothers, So those traditional relationship ways of caring for pregnant women and laboring women are successful because they optimize the oxytocin system. So oxytocin's also been called a shy hormone. We don't release it when we don't feel safe. And we have to be trusting to release oxytocin. And, going back to that evolutionary perspective, of course we do, like any mammal giving birth in the wild. It's a hazardous, it's dangerous. Any predator could detect the laboring female. She's making strange noises, strange smells, the blood, the amniotic fluid. So she has to know that she's in the safest situation possible. She's got to feel safe. That's really the foundation of oxytocin release. That's the foundation of physiological labor and birth. And that's the traditional systems of maternity care have been, someone that's related to the woman that helps her to feel safe, or maybe a group of people that help her to feel safe. And the greatest misunderstanding, I think, is that that doesn't apply to modern women. That you could just plonk a woman in a labor room with all the safety equipment, and that will make her safe. And it doesn't make her safe, because that sense of safety is hardwired into, say, her limbic system. Is there any strange smells? Are there strange people? And of course, our maternity care system is full of people that are strange to the laboring woman, people walking in and out, like caregivers that you don't know. And as I said, there's so much, an increasing amount of research about how much better labor and birth goes when the laboring woman knows her care providers. So a doula, a supportive birth companion, but even better from my point of view is having her own one-on-one midwife that sees her in pregnancy, looks after her, comes in labor and birth, looks after her for the whole labor and birth, is there for the early days and weeks, up to 6 weeks for that woman, and helps her with all that relational things. And of course, oxytocin is a relational hormone because, the foundation of oxytocin, as I said, oxyfast tocin birth, is about the mother making that relationship with the baby after the birth. That's going to really ensure the survival of the species. So you're not understanding the relational aspects of labor and birth, and not trusting the physiology. And the problem is, once you start interfering with the physiology, you kind of have to then cover up for your interferences. For example, as I said, you have to feel safe to release oxytocin. So typically, someone's laboring at home, it's going pretty well, they move to hospital and everything slows down or stops. because they don't feel safe at this primal level. And then what do? We give them synthetic oxytocin to cover up for their own oxytocin because they don't feel safe. And then the oxytocin makes labor too painful. And then their own natural oxytocin has a whole lot of benefits, including natural pain relief, but their own oxytocin levels isn't helping with the pain. So they need a painkiller like an epidural, and then that slows down labor. And then you get this cascade of intervention, as it's called. But really, the basis of it is really a misunderstanding of what drives labor and birth, which is the subjective feelings, the subjective safety of the laboring female. And we kind of know with other animals, right? Like, we look after dogs and cats and horses, especially if they're valuable in labor. We stay away, we give them, privacy, but we don't really understand that with laboring women, with humans.
Yeah, it is really amazing because even when you go to the vet and you talk about, my cat is pregnant, what should I do? The first thing they say is do not interrupt anything. Respect her
Mm.
space, let her be safe, let her, if the place that she chooses to have kittens, you let her be, you do not move her from anywhere to anywhere else, which probably would be, if she's having kittens in your bed, you would like her to have in the box, but well, if she's there, just do not interrupt, let her be. And with women,
Exactly.
we do exactly the opposite. And so that observation of feeling safe, not moving women from places, let her have their own choices, and and the things that they want to do there. I think it's so important, and it has such a repercussion in terms of the oxytocin system. Would you like to talk with us a little bit, because now you have so much experience and so much studies that you said that you're just bringing those studies all together and having some conclusions that you and your team are going to reveal. Do you want to unfold a little bit about that?
Yeah, sure. So we'll start off with a little bit about oxytocin physiology, because you have to understand that to understand how it could get disrupted with birth interventions. So oxy, as I said, oxyfast tocin birth, it makes labor go fast by causing or facilitating, we could say, the strong contractions of the uterus. It actually, oxytocin is made in the brain, it's made in the hypothalamus, it's released from the pituitary gland and pulses during labor and birth. Oxytocin goes down into the bloodstream, goes to the uterus. It finds the the oxytocin receptors, which are on the outside of the uterine muscle cell. And it's like a key going into a lock. Oxytocin's the key, the receptor's the lock. When it goes in, it turns the key, and that sends a chemical message into the uterine muscle cell saying contract, and that's what causes the contraction. So that's kind of how the oxytocin system works in a physical and we say peripheral outside the brain level. But the thing about oxytocin is it's not just a peripheral hormone, it's actually a neuromodulator. It has widespread effects in the brain. So a lot of listeners have probably heard about oxytocin as a feel-good hormone, as a hormone of love, the cuddle hormone. And it has all these positive effects, including making us feel good because it's released into the brain. It's made in the brain and released into the brain, has widespread effects in the brain. It dials down the major stress systems, including the sympathetic, the fight or flight system, the sympathetic nervous system. It dials down the cortisol system, and it dials up the opposite, which is the parasympathetic, the rest and digest, calm and connection system. So it literally, in doing this, it literally calms us down. It slows our heart rate, reduces our blood pressure. It actually increases blood flow to the skin, which is the opposite of the sympathetic. When we get into that fight or flight, that fear situation, we literally get cold feet, right? Because the blood comes from our peripheries into our core where we need it for, our lungs, our heart, for fight or flight. So when we're in the opposite system, which is the parasympathetic, which is related to oxytocin, we get literally warm. We become a warm person. We can even get a bit of a flush, which actually often happens in labor and birth. So this is really important because not only does oxytocin have all those benefits, calming and connecting in labor and birth, but it also has pain relieving properties, which obviously are very helpful in labor and birth. And it powerfully activates all of the maternal circuits in the brain that switch on instinctive mothering behaviors. It is species specific. Like for a rat, it's like you huddle the babies together and you lie over them as archback nursing, whatever the maternal behaviors that ensure the survival of the babies. But it also switches on as part of this, the pleasure and reward centers, the dopamine centers in the brain. And this is really important. So as labor progresses, and I'll come back to this point, as labor progresses, levels get higher and higher. So we'll just go back and say from early pregnancy to late pregnancy, levels increase by 3 to 4 times. It's even having an effect during pregnancy. From early labor to late labor, levels increase by another 3 to 4 times. And these are probably seriously, sorry, what's the word? They're much, these levels are much higher than what we could possibly measure because it's released in pulses, as I mentioned before. So if we measure it right now, it could be the peak of the pulse or the trough of the pulse. So probably levels are much higher than what we can measure. So we get these high levels at the end of labor and birth, and then this activation of the reward and pleasure centers. And what that means is when the mother meets her baby or babies, any mammal, for the first time, she gets the sensory information, the sight, the sound, the taste. Most mammals lick their babies, the smell, and that gets connected up, we say fired and wired, with those reward and pleasure centers, which means from the very beginning, the babies are a source of pleasure and reward for the mother. And that's why I write about, I call it ecstatic birth. It really is maximal activation of these pleasure and reward centers. And it's not just to feel good, it's so that the species survives. So those are all the effects of oxytocin. So, and we can get some of those effects by giving someone outside of pregnancy and birth oxytocin. We have to give very high levels because it doesn't easily cross into the brain, and only about 1,000th of it crosses into the brain. But of course, in labor and birth, it's made in the brain. And one more thing to say about that, which is that the baby is also making oxytocin during labor and birth. Levels are even higher than the mother from the studies that we reviewed. And what that means is we've got the mother, full of this reward and pleasure, the baby full of this reward and pleasure. And as they meet for the first time, I say it's like the best first date ever. They're both primed to fall in love with each other. And that's the foundation of reproductive success. It's not just a good feeling. But I also want to talk about how the oxytocin system works in labor and birth. We're going to pause for a minute and see if there's any questions or comments you have about that.
Yeah, because one of the things that it always pulls me my curiosity is that we are often talking about pregnancy, labor, childbirth, and how important it is to keep it natural, to keep it safe for the mother and the baby. It's so interesting that you said even the baby has more oxytocin expression than the mother, and I love when you said about the first date. I think it's so well put. And what about that understanding on how these experiences of pregnancy and birth can shape, the human being in the long term?
Yeah, I'm just going to go back well, actually, I'll answer that question now. So yeah, we don't really know that because we haven't researched it very well, but there's some very interesting new epigenetic findings that have come out that I'll go back to in a minute. But some of the things that we do know is that hour after birth biologically, it's called an early sensitive period. It means that things that happen in that hour after birth can have large impacts down the line. It's like a trajectory. It sets you on a trajectory. And if it's a good trajectory, it's going to be good in the end. If the trajectory doesn't quite hit its mark, that can have longer term consequences. And for example, there was a wonderful study done in Russia where they randomized. So these are randomized where you randomly assign people to a treatment group or a different treatment group. And this is kind of the highest level of evidence because then you know that the people are kind of similar between groups. Like if you just chose people that had decided to have skin-to-skin contact, for example, they might be different to the women who didn't decide that. Anyway, this is a randomized study of skin-to-skin contact in the context of the Russian maternity care system at the time, where the default was to take the babies away and put them in a nursery and kind of wrap them up. So in this study, they randomized women to either skin-to-skin contact in the first 2 hours after birth, to being taken away to the nursery, or to actually being swaddled and given to the mother. And then they followed those, they did quite a lot of different tests on those mothers and babies at the time. But what was interesting is they followed them up at a year later, and they could see that those mothers and babies that had had that skin-to-skin contact in the first 2 hours after birth, that was the only thing that was different, had a better relationship, had an easier relationship, got on with each other better. The babies, so they were 1 year old at that point, had better regulation as well. So that little thing that happens in that early sensitive period then has those long-term effects. So that's some of the things that we know. There was another interesting study where they looked at mothers and babies 2 to 4 weeks after birth. And they looked at mothers and babies. This is what an MRI study. So they were putting women into an MRI machine and actually looking at the patterns of activity in their brain. So they got mothers that had had a vaginal birth and mothers that had had a pre-labor cesarean. What I mean by that is it's sometimes called an elective cesarean. So they've had no labor at all, right? So none of the activation of the oxytocin system that we're talking about. And they played them inside this machine. They played them the sound of their baby crying and looked at what happened, what patterns of activation in the maternal brain. And they found that when women had had a vaginal birth, their alertness centers activated. This is my baby, I need to do something. Their empathy centers, like I can feel the need to help my baby, but also the reward centers got activated. And that kind of fits in with all the things we've been saying. But the cesarean mothers didn't have those same activations. They didn't have those activations. And the researchers at that point, and we too would say that there's been a gap there in terms of the brain oxytocin release in labor and birth that has that ongoing effect. And there's lots of other studies now of skin-to-skin contact. It's kind of become the default. We couldn't randomize. It would be unethical to randomize babies out of skin-to-skin contact, but there are countries or places where it's not happening so much. But we know that, for example, skin-to-skin contact in the first hour, one of the reasons it's advocated is because it's so important for breastfeeding success. It's part of the baby-friendly hospital initiative from the World Health Organization to improve breastfeeding rates. So there's lots of other good studies, or increasing number of good studies about skin-to-skin contact in that hour after birth. But especially, we're starting to look at those longer-term effects there. But what was been really interesting is a recent study that came out by some Japanese researchers called Maejima, Maejima, and this is about the epigenetics of oxytocin. So I'm just going to explain what epigenetics is. So we
Yes,
have this
that's so interesting.
So we have this DNA in our cell, and it's kind of like a blueprint. Yeah, we have the DNA, and it's got a sequence which tells our body how to make the proteins and all the parts of our body that we need. The enzymes, the cells, all of that is coded by the DNA. And the DNA doesn't really change over time, but parts of the DNA can get turned off. We call that demethylation, because it's basically a chemically methyl group gets stuck onto that bit of the DNA, and then that can't get expressed. The expression of it is actually a copying of it. The DNA is copied to RNA, and if that bit's blocked off, then that bit doesn't get copied. That's called methylation. And generally, methylation is a negative thing. Generally, it has negative consequences because it means that part of ourselves that should get expressed is not getting expressed. Now, there's also a process, I wasn't even aware till I read this paper, called demethylation, where the methyl groups actually can get removed. And what they found in this study was that they looked at rats that were aging, so young rats and older rats, and they saw the older rats had lower levels of oxytocin, and then all these kind of inflammation, kind of negative effects on all their cells and everything. By the way, oxytocin has anti-inflammatory effects as well, antioxidant as well. So then they actually gave these senior rats high levels of oxytocin. They've got to give very high levels to get through the brain and etc. And they actually found that after they did that for, I think it was 10 days, that their oxytocin system changed, and they figured out that it actually demethylated the oxytocin receptor, I think it was, or the oxytocin gene. Anyway, they demethylated the system, which means that these rats then released oxytocin. And the implications of this, for what we're talking about is really that, those high peaks of oxytocin around the time of birth for the mother and for the baby, and then after the birth, we'll talk about that in a minute, could actually have long-term effects on the methylation or the demethylation system, oxytocin system. And this makes sense because it explains some of the findings that my colleague Kirsten Uvnas Moberg has found in her rat study. So she found that giving newborn baby rats, regular doses, high doses of oxytocin, or giving them a massage with a paintbrush, which releases oxytocin, kind of like a rat massage, had those animals that had that treatment had lower stress levels in later life. They were less stress responsive. And it's probably by an epigenetic mechanism, like I've just described, that actually demethylates the oxytocin system. So what that means, as I said, is that those oxytocin-rich experiences, which is not just labor and birth for the mother and the baby, but after labor and birth, that skin-to-skin contact. One study found that I said oxytocin increases as we can measure it from the beginning of labor to the end of labor by 3 to 4 times, probably more. But in this study, they had mothers and babies skin to skin, and some of those mothers increased their oxytocin 10 times more in that hour after birth through skin to skin contact and the baby's first pre-breastfeeding behaviors. The baby will, the breast crawl, Google it. The baby will find the breast and massage the breast with the hand and eventually suckle. So those things. And then every time mother and baby breastfeed, the mother gets oxytocin from the letdown reflex, as I described. The baby gets oxytocin from the suckling, from the contact, particularly from skin to skin contact. So all of those things are, the early mothering is oxytocin rich experiences for the mother and for the baby. So what that means is what this research means is that those may actually impact the long-term oxytocin system for both. And there are some other interesting findings around that. For example, the more children that you have, the lower your blood pressure is, the kind of more parasympathetic you become. You become a bit less sympathetic, less stressable. You become a bit more stress resistant. And of course, that makes sense. Like in all of nature, we want mothers to be able to look after their babies well, because that's going to have the baby survive, So we want mothers to be able to dial down their stress system. So this is a long-term way of doing it. And of course, every time that we breastfeed, we release oxytocin. It has all of these measurable effects. It lowers the heart rate, lowers the blood pressure, lowers cortisol. That was one of the findings in our systematic review. As the oxytocin during the breastfeeding episode went up, the cortisol went down, basically a mirror image. That's the effect of oxytocin. So all of these short-term effects are likely to have like long-term consequences as well.
Yeah, long-term impacts. Very interesting. I think that the last part that you're talking about, as you have more babies, you become less stressful. I think that there are a lot of mothers with multiple babies that can definitely relate with everything that you're saying, and now science is trying to explain that. For professionals that are listening to us, as midwives, doctors, doulas, and even educators, what do you think are the most important shifts that need to happen, to better understand and protect the physiology of labor and support these early beginnings?
Yes, well, I think, there's one thing I do want to talk about. So as I said, we've done studies, systematic reviews of physiological birth, breastfeeding, synthetic oxytocin, and epidurals and cesareans. And that whole process of releasing oxytocin in labor, it's called the Ferguson reflex, if anyone that studied these things, or it's a positive feedback cycle. And what happens during labor and birth that makes these oxytocin levels go up so much, I call it the snowball of labor, is the positive feedback that happens from the sensations of labor and birth. So the sensations and the sensory nerves in the lower cervix and the vagina, they feed back to the brain by specific, it's actually a parasympathetic nerve pathway. And when that information about the sensations in labor reaches the brain, it tells the brain to release more oxytocin. So the brain releases more oxytocin that gets into the bloodstream, causes stronger contractions. The baby moves lower. There's more sensation. If you've had a baby, you'll notice this. And then you get more feedback and more oxytocin release. So it's making sure that as I say, the labor gets bigger and bigger, like a snowball, and in the end it becomes virtually unstoppable. But it also means that as the contractions get stronger, there's more oxytocin release inside the brain. So there's more calming, connecting, pain relieving effects. And if you think about like any other animal giving birth, goodness me, first baby, you've never seen it before, you've never experienced. I mean, the mother could totally freak out. So all of these calming, pain relieving natural effects are there to help the mother, to soothe the mother so that she stays put and doesn't freak out when she's having her babies. And true for humans as well. So calming, connecting, pain relieving, all of these effects are happening in the brain during labor and birth because of this feedback cycle. And the feedback cycle, as I said, depends on the sensations. So what we've looked at with our epidural study is what happens if you completely abolish the sensation. which is what an epidural does. I mean, it's a great form of pain relief because it does abolish the sensations. It's an injection of a local anesthetic and other drugs into this epidural space in the spine where these sensory nerves pass. It's like getting a dental anesthetic. It's injected next to the nerves and it numbs the nerves, right? And it does have some motor effects, especially the older epidurals, like a dental anesthetic. You can't move your mouth so well, right? But an epidural, because it's given in labor, and it stops those sensations. It slows down this positive feedback loop, this Ferguson reflex, as it's called. And what it means is it slows down the release of oxytocin. So what often happens with an epidural is labor slows down or stops, and then you have to give someone synthetic oxytocin to speed it up again. But also we get this, as I say, hormonal gap, not just in the body, but in the brain. So all those positive effects in the brain are not happening. And we know this from animal studies. So they've given animals, they've given cows, sheep, and goats epidurals, and they can measure their blood oxytocin goes down, their brain oxytocin goes down. They don't connect to their babies. They don't get that bonding after the birth unless you inject oxytocin back into the brain to fill in that oxytocin gap. So, I guess that's a take home really for me from this research is when you bring in an intervention, you might be disrupting some really important physiology. And what we've seen in the epidural studies, which is, makes sense from the physiological understanding, it aligns with animal studies, is that oxytocin levels go down, when you give, and these are human studies, women having epidurals in labor, their oxytocin levels either go down or they don't go up as they do normally in labor. So there's an oxytocin gap. And then after the birth, there's a big gap. They don't get this increase that I was talking about after the birth, which is so important, I think, for the pleasure and reward centers, not just that, but all those other things we're talking about, antioxidant, anti-inflammatory, all of those things that oxytocin benefits in physiological labor and birth are at risk when someone gets an epidural. So an epidural isn't a free pass, it's not without consequences.
Yeah, yeah. Thank you so much for this teaching. I think that was this conversation that we just had, and you just made it's really wonderful to talk with you because the way that you communicate science, I think it's very relational, and it's free for people to really understand and perceive how important it is, the work that you are doing. So,
Thank you.
Sarah, thank you so much for being with us today.
It's a pleasure. It's a pleasure. Yeah. And I just want to say, anyone listening out there as a maternity care worker, as a expectant parent, you really can trust your body. Your body has been, as I say, superbly designed through all these millions of years of evolution, and it's designed to work. And the way to make it work is to really, honor our evolutionary heritage and make sure that laboring women are supported, but in a way that they feel safe. And I say that the core requirements for birth is that the laboring female feels private, safe, and unobserved. So take that home and try that out with your patients, try that out with your clients, try that out in your own experience, how private, safe, and unobserved you can be, and then see how much that benefits labor physiology.
Wonderful, wonderful. Thank you so much, Dr. Sarah.
Yep. It's a pleasure.